This short video is on the rehabilitation of patellofemoral syndrome. We will aim to keep this video as short as possible, but without compromising on vital information. If you are watching this for the second time, then you might want to skip past the short theory section and go straight to the rehabilitation and exercises advice. Sophie, we're going to cover now exercises and advice relating to a condition known as patellofemoral syndrome.
And in simple language, what is this syndrome?
Okay, as the name suggests, patellofemoral means the patella, the kneecap, and the femur are involved.
Okay, so what area exactly is affected?
Well, the most problematic area is the contact area between the patella, the kneecap, and the femur. So if I can just show you on a model, okay, this is the model of the knee, yeah, flexing and extending. Here we have the quadriceps attached to the patella tendon and then the patella ligament, and the kneecap or the patella glides, as you can see, on those surfaces there. Yeah. Now, this gliding has to be done on smooth surfaces. So the femur is covered by a cartilage, a hyaline cartilage. So is the underside of the patella. So this cartilage enables the gliding. Now, many things can happen: arthritis, subluxation, injuries that can cause damage to either of these two surfaces. In many cases, the quadriceps are part of the problem if they're not balanced and they're pulling the patella to the side. Quite commonly, it's actually been pulled to the outside, yeah, because that's the tighter side. And then we need to engage the other muscles, the medial muscles. So that's one of the causes. It's also referred to as runner's knee as well by some people. So let's cover some exercises on rehabilitating this condition. Let's begin the exercises with something very simple: stretching of the quadriceps, using a chair or a stool to rest your knee on. So put one knee on the stool, bend it and hold it with your hand either at the ankle or at the foot. Feel the stretch around the quadriceps, hold on to that. And if you want to increase the tension, pull this a little bit more or bring that knee a bit further forward if you want, so that you can slightly bend that one and increase the tension. Yeah? Hold on to it, relax a bit, go back, and then repeat. Depending on the health of your knee, if your knee is inflamed, is painful, you may not be able to flex the knee to this extent, and you can do the same thing, in fact, Sophie, with the leg straight. Let the leg go straight, and then you tilt the body forward, again, feeling the stretch on your quadriceps, hopefully, yeah? That is an equivalent exercise without bending the knee too much. Yeah, excellent. Thank you. Let's continue the stretching exercises of the quadriceps. Now, again, using a stool or a very low chair or a bench or something like that, you're going to have the foot on the stool and you're going to bend the front knee. Yeah. So if the floor is hard, it's going to really upset your kneecap, and we don't want any pressure on the kneecap. So you may want to put a towel underneath to cushion it. So fold a towel, put it underneath there to give it this extra softness. And in fact, I don't want you to put a lot of pressure on the kneecap. We really want to focus on stretching the quadriceps there. And by tilting your whole pelvis forward, you increase the tension and then go back again. And so forth. Yeah. Good. In fact, you're also stretching the psoas as well as the quadriceps in that position. Yeah. Thank you. Okay, let's continue the stretching now with stretches of the gluteus muscle, the buttock muscle. There's one particular exercise you can do with you lying on the floor with your one of the feet against the wall, crossing the other one in front, so that we're getting some tension on the glutes. So lie down, face the wall, put one foot on the wall, cross the other one. Okay, so hopefully you should feel the stretch on the left side. By getting closer to the wall, you increase the tension. By being further away, it makes it easier for you. And because you're not using that leg should be relaxed so you achieve better stretching. It's quite a passive exercise. You just lie there basically for a couple of minutes, and then you can switch over to do both sides. It's always a good idea to stretch both sides, even though one of the sides may be symptomatic. Yeah. Another stretch of the quadriceps is the most commonly seen in the gyms. It's called pulling the leg backwards whilst you're lying on your side. Yeah. So let's have a look at that one. Again, if your knee is painful, you may not be able to bend it all the way backwards. Hold the ankle. Yeah. And gradually increase the tension of the quadriceps by bringing the foot backwards towards your back. Yeah. Obviously, the tendency, if you pull it a lot, is to extend the lumbar spine and twist the pelvis. We don't want to do a lot of that extension in case there is an issue with your spine. So by keeping that leg bent as you have it, you stabilize the pelvis. The pelvis is not rotating as well, just the top hip joint, so that you are stretching the quadriceps. Lovely. Thank you. The next one, Sophie, is both strengthening and stretching exercise of the quadriceps, and it involves having the elastic band around your foot whilst you're lying facing down with the knee bent behind your back. So let's have you lying down. Okay, if I do that for you, it makes it easier. So put the elastic band around your foot like this, and you need to take control of this there. Try not to overextend your back. I know you're a very flexible person, but most people won't be able to extend. So keep your back as stable as possible. Yeah. So push the foot away, extend the knee. Yeah. So you're actually engaging the quadriceps. Hold it, and then after about 3 seconds, you pull it towards your back. Yeah. So you're actually stretching the quadriceps when you recoil, but when you bend the knee, I want you to pull this a little bit further so that we're getting the stretching on that side. Yeah. So you can calibrate the tension yourself according to how you can manage the flexing or the extending phase. Yeah. So that's quite a dynamic exercise. Thank you. The next exercise is working on your quadriceps with a roller like this. This one is called uneven surface to help you break down the fibrotic and tight tissue. And especially the outside aspect of the thigh, that's where most of the tightness are, the tensorfascial lather, the iliotibial band, and that area there is quite tight in a lot of people. It may be a bit uncomfortable, as we said in the earlier presentations. Maybe choose a different roller with a smoother surface and a slightly softer one. And this one may be uncomfortable. If it is uncomfortable or too uncomfortable, it will always be a bit uncomfortable. But if it's too uncomfortable, then put a towel around it. So let's have you on your side. So support yourself with your hands, bend that leg and have that foot for stability, and work on a small area by doing small movements up and down. So maybe do 3 or 4 in one position, and then shift the position further down or further up to do the whole side of the tensorfascial lather. Because as we said before, the kneecap sometimes deviates laterally, and that will help to release that tight muscle. Try that. Maybe a little bit more forgiving.
Yeah.
Yeah, that's good. But there's quite a few rollers out on the market. Start with a slightly softer one and then go into the harder one with the uneven surface, the ribbed surface. Good. Thank you. The next exercise, Sophie, is actually more engaging. We're going now into the engaging, strengthening contraction exercises. So you're going to contract the quadriceps by lying down facing up, but having a roller or a rolled up towel under your knee. So let's do that. What you're going to do, you're going to contract that muscle for me by extending the knee on the roller and pointing the toes upwards. So are you feeling the engaging? You're engaging that area there. Slow motion, go back down, and then again. I know it's a very subtle exercise, but if someone had a surgery or they are vulnerable or they're weak, this is one of the ways of actually strengthening the quadriceps. Yeah, maybe an elderly person, yeah. So you're not challenging it too much, but sufficiently to get the benefits. Good. Okay, let's continue with the strengthening exercises now. We're going to try and engage more the gluteus medius and minimus and the tensor fascia lata by doing the clamps, where you open your thighs outwards, keeping the feet together. First without the resistance and then with the resistance. So let's have you on your side, facing this way. Put your feet together, push them together, and slow motion, open your thighs upwards, hold on to that, and then go back down. Again, it may seem as a very simple exercise, but there are benefits to be gained, especially in the early phase of a rehabilitation program and in those who can't do anything more challenging. So to make it now more challenging, have an elastic band or a thigh band around the knees areas. Slowly, in a controlled fashion, abduct your thighs up to a comfortable level. Hold it, count to 3, slow motion. Close the thighs, get your breath back, and then off you go again. Hold it, and then back down. Do you feel the muscles being engaged on the outside there?
Yeah, absolutely.
Yeah, it isolates those muscles quite nicely. Excellent. The next one, again, is doing the clamp, but slightly more challenging, whereby you're going to have both feet suspended off the floor whilst you're doing the clamp. Okay, let's see if you can manage that. Feet pushed together, but lift them off the floor. That's it. That's it. Yeah. So you're keeping the bottom leg as well as top leg off the floor. So you're actually engaging that leg as well as this leg now. You are using the inner muscles, the adductors on that thigh to keep the leg upwards. And you're using the abductors on that to open the thighs outwards. Yeah. So you're strengthening the inner muscles on that and the outer muscles on that leg. The next one is one of the most useful exercises for strengthening and balancing the quadriceps. And it involves doing squat basically, or partial squat, by gliding against a wall. Okay, so put your back against the wall, put your feet at the front there, and keep your back against the wall, so nice straight back, and do a gentle flexion with your knees. Keep going until about 45 degrees. We don't want to flex it too much. You hold on to that, and then you go back up. Maybe put your feet a little bit closer to the wall. So when you're bending your knee, you don't want the knee center of gravity to fall too far away from your toes. Yeah. So another variation to that, in order to engage a very specific part of your quadriceps, is to rotate your feet outwards a bit. That's it. So as you do the squat again, Sophie, what you're doing, you're engaging that area there on both sides, and that is the VMO area, the vastus medialis oblique, which is important for stabilizing the trajectory of the kneecaps. Because if there is imbalance and deviation to the outside, that will help to stabilize it on the medial side. So it engages the VMO by having slight rotation of your thighs. Another variation to that is actually using a ball behind your back to roll down. There you go. I'm not sure if you support a certain team, but I don't see any team on this. So use this behind your back and roll it down the wall. Again, we don't want to flex to 90 degrees, 45 degrees, because remember, if you flex too low, you're putting too much pressure on the kneecaps, and the kneecaps already have a condition. We want to engage the quadriceps without damaging the patella by having too much friction. It's a balance between too much friction and strengthening the area. The next exercise, again, it's an engaging, strengthening exercise. We're going to do some knee and hip extensions by using an elastic band again. Now you need to attach this quite low down if there is a hook on the wall or a very steady surface. Hook that onto that and then push the foot away. So let's pretend that the tape is attached to something, although I'm holding it. So that's about the area you want the tape attached at this level. So by maintaining the tension now, I want you to extend the whole leg backwards, hold on to it, and then allow it to come forward. Again, what you're doing, you're challenging your stability as well as the strength. In fact, most people might want to hold on to something when they're doing that, because you're putting quite a bit of tension there. Another variation to this, Sophie, is to keep the thigh straight, but just bend the knee. So you're actually using different muscles now there. That's it. And relax. So the tape needs to be quite low down, like that. Bend the knee, keep the thigh parallel. Yeah. So that's strengthening. Again, the hamstrings are also part of the calf muscles as well. Primarily the hamstrings there. Good. Our next exercise is to engage and strengthen the adductor muscles. As we said at the beginning, with the patellofemoral syndrome, in many cases we find that the adductor muscles, the medial muscles, are not strong enough, not balanced enough, and then the outside muscles take over and they pull the patella laterally towards the outside. So let's do some strengthening exercise for the adductors. A simple one is to use a ball between your thighs as you lie down and squeeze it. You can also use a cushion or a pillow or something else like that. Start from near horizontal position, squeeze the ball, count to 3, and then relax. Do about maybe 5 repetitions there, and then change the angle of your knees by bending them a little bit up. Okay, and then you repeat the same procedure there. Do a few repetitions, relax, and then again, and then relax, and then bend the knees a little bit more. And then we're engaging different parts of the adductors by changing the flexion on your hips. Yeah. As I said earlier on, you can fold up a pillow or a cushion, put it between your legs, and you can do exactly the same thing. In fact, it might be easier with a cushion at the early stages. This might be a little bit hard in some cases because the medial aspect of the knees can be quite sensitive when you're compressing. Again, continuing with strengthening exercises, we want to now strengthen the adductors in the standing position and the abductors as well, depending which ones you need to balance. And if you've seen a personal trainer or a physical rehabilitation specialist, they will tell you where to focus, but let's cover those. So let's do the adductors now. So stand face this way for me. Have the elastic band around your ankle and attach it to a surface. You may want to hold on to something. Have this leg slightly forward and then close your thigh like that. So you are engaging, obviously, the inner thigh muscles, isn't it? Yeah. And again, hold on to it at the end, count to 3, and then back to neutral, and then again. Good. Now, in the same position, we want to strengthen the abductors on that side. It's simple. Put that around that leg. Put that one further back and this one forward. So now you're going to go that direction. So you're engaged in the abductor. So pull outwards, hold on to that. Yep. So you're engaged in the part of the glutes and part of the tensor fasciae lata and so forth. Yeah. Good. And if you want now to do the other sides, what you need to do is simple. Just rotate, face the wall, and put it forward a bit, and close the thigh inwards. So you're doing the adductors on that leg. And again. And by changing the band onto this leg, you're going to do the abductors on the left side again. Pause, back down, and again. Great, thank you. Next one, Sophie, it's again quite a fine-tuning one, quite a challenging one, is to strengthen the quadriceps, but also improve your balance as well, and it isolates some knee muscles quite effectively. So you need to have the elastic band, again, attached onto a low-level surface, and loop it around your knee like that, just behind the knee, in fact, like this. So you're going to do just a small amount of squat, not too low down, while the tension is maintained here. So if you want to put the toes on that one on the floor just for a bit of balance, it doesn't matter, provided you do all the work on that leg. Yeah? And you can hold on to a wall. But if you train yourself well, then you can just open your arms and do it without any support. Yeah. Let's show on the other side so that you see how it comes across. Keep the tension on. Small amount of squat. And up again. Good. You've got a good balance there. Excellent. Thank you. The next one is both strengthening and also balancing. It involves you stepping with one foot on a towel because it's a little bit uneven surface, so it challenges you doing a very small amount of squat. Yeah. So, see what you can do with that. Okay. If you open your arms, you get a bit more balance. You can also hold on to something if you want. Okay. Do a little bit of a flexion on that knee and then up again. And that's good for balancing, especially those who are rehabilitating their joints after a surgery. Could be a hip surgery, it could be a knee surgery, but you can only do that provided you had advice from your specialist before you engage on these exercises. Yeah, I mean, in the early stages, so if you're an elderly person with poor balance, you can put both feet on the towel and you can do the squats on the towel like that. Again, it helps you with the proprioception, with the balance. And there's even a more specialized device, is a wobble board. And we've covered the exercises under a different presentation when we did arthritis of the knee. So stepping on the wobble board and balancing yourself after surgery is very important, but only when you are ready for this. There are various types. This one is a little bit challenging, but there's more smoother ones, which is easier to use. But you can improvise with a couple of towels on the floor. And the last of the exercises, again, is engaging the quadriceps and the glutes by doing single leg squat only to 45 degrees and then back up again. That's good for balancing and strengthening. So let's have a look at that. Again, those who cannot do that, they can put the toes on that leg down for a bit of stability if you want, or you can hold onto a surface. Yeah, and then eventually once you improve, you can do it without support. Yeah. If any of these exercises do cause undue pain, you need to stop and get some advice, as with all exercises. So after the engaging exercise, we've done quite a lot. It's always a good idea to finish with some stretching exercises. A bit of stretching the quadriceps, the hamstrings, the calf muscles, and even the pelvic muscles as well. Yeah. Sophie, thank you again very much for volunteering for this presentation. Causes of patellofemoral arthritis and dysfunction. Wear and tear of the articular surfaces of the patella and or the femur. Softening of the cartilage. Weak or poorly balanced muscles. Old or recent injuries. Excessive weight and other factors. Patellofemoral arthritis and dysfunction. Strengthen the leg muscles. Stretch the quadriceps muscles, balance the action of the quadriceps muscles, improve core strength, lose weight, avoid very high steps whilst recovering, avoid low-level squats, especially with weights, and consider a suitable knee support or strapping.